Good afternoon. Thank you for joining us today. We here at Prisma Health love to share information with our community to get them ready for big events. And as you know, that big event is going to be back to school. So we're excited to be here with our panel. We always are trying to make sure we provide good information to the community. So we have our participants, which of course I think Rebecca mentioned, were Dr. Jeremy Byrd, who's a pediatrician with Prisma Health in the primary care Fountain Inn. For those of you in the upstate, Carla Nowicki. Thank you, Carla, for that pronunciation. And Jeffrey Williams. So Carla is a registered dietitian. Now, we got some hard times trying to get those kids to eat the right things and making sure they get all the nutrition they're supposed to. And there's some picky eaters in there, we know. And then, of course, Jeffrey Williams, licensed professional counselor and the Prisma Health Director of Behavioral Care Outpatient Programs. All right, so with that, we're going to go to Dr. Byrd with my first question. Ooh, thank you, Dr. Byrd. All right, so it's that time of year. A lot of people are getting those immunizations or not. And so, what immunizations are they needing for school, and what advice do you give to parents about getting them?
This is a great question. Hopefully everyone can hear me clear, given this is our first go of things. So it depends upon the age of your child. The kiddos that are younger and are entering 5K or 4K, we want to make sure they've had their 4 and 5-year-old shots. And so, of course, that includes shots such as the measles, mumps and rubella vaccine, the chickenpox vaccine. There were a lot of other ones they would have gotten when they were younger, but most kids would have gotten those shots even before they went to school. And so really the kids that we have to think about vaccines that may have impact their ability to return to school would be the 11 and 12-year-old range. And that includes the tetanus vaccine, which is a booster, as well as there's a meningitis vaccine, which is not required, but suggested that kids get that for a return to school. And then, it's a little bit early in the season, so we're already thinking about flu, but and we're seeing patients in the office that have flu-like symptoms, but we're not giving a flu vaccine yet. That will roll around probably in September, October. And then the final one is the COVID vaccine. And there's a lot of thoughts about this, a lot of disagreement, a lot of hesitation amongst parents, which I completely understand. But recently it was approved all the way down to 6 months of age. And the only thing I tell my parents regarding this vaccine prior to even kind of talking about the pluses and minuses is just that my own kids got it. And so I have a 10-year-old, a 13-year-old, and a 16-year-old, and actually a 19-year-old, and they all got the COVID vaccine, did fine, no problems at all. And the main reason why you may want to consider that vaccine is just we found during the pandemic that a lot of kids were missing school, and it was impacting their academic improvement, particularly compared to other kids. And so if a kiddo got the COVID, got the COVID virus, then they would be out of school for a week. And that's hard to recover from, particularly if they're in demanding courses. So that's the thing you have to weigh out as parents in those regards. I think those are the main vaccines you need to think about as you kind of return to school. So nothing new aside from the COVID vaccine.
Good. With that, we're going to go over and ask our dietitian to add some information to that. So, okay, Carla, at what age is it okay for kids? I'm sorry, wrong question. What else can parents do to boost their kids' immunity before heading back to school?
Yeah, so immunity is a huge topic right now. So how do we prevent this in our day-to-day life, not just with these amazing vaccines as well? But there's so much you can do day to day, and that would be the general healthy diet, exercise, and lifestyle aspect. And what does that mean? Because healthy is a very relative term. It means very different things to very different people, but there's a little bit of a standard of, okay, what is generally accepted as healthy and what we're trying to strive for. And when it comes to exercise, the goal I usually help individuals strive for is 60 minutes of play a day, something active. And I think play is anything from a toddler running around and finding things in the playground up to a 70-year-old finding aqua aerobics or going for a walk or just being able to move in their chair. It's different for everyone, but it's something that you enjoy for those 60 minutes. And additionally, when it comes to diet, healthy is very relative. Diet is just a combination of all the things that you eat, but certain pieces are incredibly helpful. And I always like to help people find 4 things in every meal, and that would be a starch or carbohydrate, a fat item, a protein, and a vegetable. All right, so kind of looking at that plate in general, saying, is there something on that plate for each one of these? And then how that plate looks like broken up to, is there enough space for the vegetables to really sit in there and have a good star of the plate? So what is the star of the plate? And hopefully we find a way to make those vegetables a great star of the plate, because that can really help with your immunity. And the huge part of sleep. I know we'll talk about this soon, and Dr. Byrd will take this off and help that, but there's such a huge amount that sleep can help with to prevent your child from picking up these bugs a lot of the time. When it comes to supplements, a general multivitamin can be really helpful of just being a catch-all of what you potentially could be missing. And a chewable Flintstones is going to be a great option. If I try to suggest, I usually recommend something that's chewable or a hard pressed pill or a swallowable pill. And that way we know we're at least getting a better composition. Not everything makes it into those gummy vitamins all of the time. So if we can go for one of those, I recommend. But when it comes to other supplements that are for immunity, vitamin C and zinc and your vitamin D would be my top 3 choices for you. Beyond that, let's maybe think about the quality of our multivitamin if we want to spend a little more, or the quality of our food.
I was going to say, Dr. Byrd might be the one to answer this too, but what if you can only get the kids to eat those gummy vitamins? Right, you know, they taste pretty good and they're like, yeah, I'll take that, but that pill might be a little harder to get down.
Something is always better than nothing, and a lot of the time it's starting younger with the chewables and maybe not always making the gummies an option at first. It takes learning those things all the time to find these things. So starting younger usually really helps. But if we're heading backtrack, trying to work small steps might be helpful. Not every war is worth your battle.
I agree with that. All right, Jeff, we're going to add some more conversation here. All right, Jeff. So the question is about, you know, the kids are coming back from school, and parents have a question about, when is it okay to leave your child home from school after school by themselves?
That's a pretty complex question, because every kid develops on its own time frame. So you want to look at core areas of their functioning. So are they able to be safe in the environment by themselves? And are they able to be responsible for what is in the environment? For example, if you have a younger sibling in that environment, is this child able to respond if something were to not happen or to happen that wasn't planned? You look at cognitive readiness. Can they think through the decisions they need to think through as required? And also emotional readiness. How does this child respond when normally challenged, you know, in supervised environments? And that could be a good indicator for what they're prepared to do independently. You know, and you would start gradually. You wouldn't go away for an hour or hour and a half. You might pop over to your neighbor's house or make a quick errand, but and you'd have a backup plan always in case you were not able to come back as you had originally scheduled. And also that child should know what to do if you were not back when you said you were planning to be back. So those are some guidelines for how you could make that decision.
Oh, good. Okay, we'll go back to Carla about some more nutrition things. All right, Carla. So the question is, you know, how do we, you know, go back to school? There's some items for sale at school. There's some, you know, school lunch, people take lunch. How can parents help ensure that their kids are going to get their nutritional health met while they're in school?
Yeah, that's a really complex question when it comes to feeding, because everyone's going to choose different items a little bit, and having those conversations with your child. Some children will have hard times eating school lunch and what they're emotionally comfortable as well, but also what is available to you based on your needs. It's very understandable to utilize school lunch as need be, but also if you want to pack that lunch, having the child be able to choose the items a little bit of what they want, but being able to make sure you're going through those 4 carb, fat, protein, vegetable items again in that meal. So it's maybe allowing them saying, what vegetable would you want in this? And let them choose carrot sticks or celery sticks, but having that opportunity there. The other thing is being aware of the rules of each classroom and the school rules of what they're allowed to bring with them. Are there certain classes where they are allowed to have a snack, certain classes where they can't, and what those rules are, as well as bathroom policies, helping them understand when to best hydrate, because hydration is a very key element to go through of making sure we have enough nutrition, is hydration. And there's nothing better we can do than water. And I always get the question of, well, my child doesn't drink water. I don't do water. And working with that slowly, similar to picky eaters, of what are we willing to do and work our way down. And sometimes it just takes a little bit of, okay, we'll just have a small sip of water every day and working from there. But always sending hydration along with that and finding when they're allowed to have that water and be able to speak up for your child to say, no, my child does need to use the restroom, and finding out when those available breaks are can be really helpful.
Good deal. We're going to ask Dr. Byrd some more about sleeping. Dr. Byrd, sleep is such an important part of everything that we all do. And as you know, many of us, including me, I would say, probably don't get enough sleep. So what do you say about sleep, and how can parents make sure that their kids are kind of getting back into the routine after probably staying up a lot later than they usually do during the summer?
Yeah, it's a great question. I want to piggyback what Carla said. You know, our goal is truly to help build their immune systems, give them the best opportunities of success at school, and develop good habits as well. And so my kids have been staying up way too late between, I don't know, everybody's kid is different and depends on the age, which is an important thing. But, you know, recently between 10 and 11, and for young school age kids, that's just too late for them to get their sleep. Now, the next question parents always ask is how much sleep is too little, too much? And that all depends on age and your kid, truly, as well. But I shoot for in the range of 8 to 10 hours, depending upon the age of the kid. And that includes teenagers. Teenagers have a tendency to go 5-6 hours, and that's inappropriate. They really need that 8 hours of sleep. And so your question about what you can do, and we do this usually the week before, if vacationing and all that kind of stuff allows for it, we just kind of transition over to those bedtimes. Or usually if you're getting up early and doing whatever it might be, your body is tired in the evening. The problem is if everyone's sleeping in till 9, 10 or later, then they don't want to go to bed. And so if they don't want to go to bed, then you're going to be fighting a battle. So trying to slowly roll back your morning wake up routine. So let's say your kids are waking up at 10, maybe they wake up the next day at 9, and you do that for a few days, and you roll it back to 8, and then you just roll it back to whatever time you need to go to get started. I love that our nation recognized that teenagers need more sleep. And so a lot of our high schools start a lot later, which is outstanding. The idea and intention is that they are sleeping more. We know our teenagers are not probably doing that, but we can always encourage them to do the right thing as parents. So the short answer is rolling back their routine to where they're waking up a little earlier, so they're actually tired in the evening. And then healthy sleep habits and sleep hygiene. A lot of my patients, they have TVs in the room and devices in the room. And I think we have a question coming up on devices. But you know, this is probably not setting them up for success. Something my family changed a few years back was we just had devices done in the living area, and our kids have to plug their devices in the living area. Now, it's not always possible for your teenagers because they're staying up later and doing, you know, whatever, but at least for the school age kids, you can kind of remove those devices and kind of put them there inside the living areas, so that they have to unplug from their devices, them personally, and kind of go into their room to read a book. And then having a good routine for your younger age kids, which really starts in like baby age. Our babies we would read them a story, and we do a bath, read them a story, sing a song, and put them in bed. We do some version of that with all of our children. And so as they got a smidge older, they were used to, hey, I'm gonna take a bath, I'm gonna read a book, I'm gonna go to bed. You know, it's kind of calming down as they kind of go along. So
Good
yeah,
deal.
just routines and rituals.
I love that. So we're gonna go to Jeff. All right, Jeff. Parents are always navigating, the special needs of their child, whatever they are. So, what's the difference between a learning disability versus a behavioral disability? And how can parents tell if their child might need help? And, how do they get that help?
Sure. Yeah, it is hard to navigate especially when children are in development and you're not sure what you're seeing. And sometimes we kind of revert back to our own experience growing up or what we learned growing up, as opposed to what is contemporarily and presently true. So you really want to monitor your child's ability to navigate across different environments. You see a child with a learning disability present perhaps kind of in an uneven way. Sometimes they're able to master some things and sometimes they're not. They sometimes act a little bit younger than they are chronologically, and that can be a red flag. And also sometimes their responses or their ability to interact with material doesn't seem to match what the material is calling for. They may look at it but not really see it, or they may hear it but not really be able to act on it. Different learning disabilities, include auditory processing disabilities and reading disabilities. When you compare that to a behavioral disorder, you're looking more for a disruptive behavior, which can include anxiety-driven behaviors, as well as attention focused behaviors or oppositional behaviors. Those are the three core ones that you often see parents struggle with. And those are signs that you need some support when they start to interfere in major life areas and when they continue beyond a certain period of time. Usually 6 months is the guideline for the presence of a behavioral disorder. Anyone can have a reaction to a circumstance or an event, but if this behavior is prevalent across different seasons, then you may have something that you need to address. And in either case, you don't want to disparage or be pejorative or negative to your child about having that. We as adults are responsible for what we do and say, and we are sometimes very human, and we're frustrated, and we want someone to get something before they can. And that can have a pretty significant impact on a child who's in development and trying to learn and master a skill. So you don't want to induce a sense of shame or embarrassment when you're frustrated about their ability to navigate through a certain task or environment. How do you get the help? You first consult your educators. You may also consult a mental health specialist to do an evaluation to really kind of hone in and know what you're working with, whether it's learning, behavioral, or a combination of both. And then you follow the treatment plan through the pediatrician, through the educator, through the mental health specialist, and through advocacy agencies that are designed there to provide you support. It's really important that you not get in a battle with an educational institution or your doctor or your provider, but you work in a collaborative manner and not get defensive on behalf of your child, or perhaps even tap into your own sense of frustration, and you may feel a little bit embarrassed or anxious about your ability to manage your child's problem. And it's really important that we be self-aware and react on behalf of the child in community with the people who are available to help.
Good, thank you, Jeff. I'm going to go to Dr. Byrd. There's a lot of different things that are in the school systems designed to help children. And so there's IEPs and 504s. So Dr. Byrd, what are the differences in those things? And, I know Jeff was just talking about, some of the things he just talked about will be going to some of these plans. So can you give a brief description of those?
Yeah, I think, that's kind of hard for parents. And I think ultimately, I think the parent's job is to recognize, hey, my kiddo may need help in the classroom, as Jeffrey was just saying a few minutes ago. And then in terms of whether it be an IEP or a 504, parents don't need to worry too much about that. But in short, an IEP is something that will help out your kiddo from K through 12, whereas a 504 can help them both in K through 12 and in college. And so based upon my understanding of it, a lot of my patients have IEPs. They just need a little extra help in class. The best example I can give is one of my sons. One of my sons had issues with handwriting, and his writing was awful, and he couldn't keep up, and he couldn't even read his handwriting. And so he got an IEP to help him with doing everything on the computer, or word processing. So that is something that he will not carry through to college, and he's actually gotten a little better as time has gone on. So that's an IEP. Whereas a 504, it might be something that focuses in on the kiddo, and it may be something that they carry throughout. A kiddo who has a hearing disability in elementary school is still going to have that in college, and so that is something that lasts a little longer and can address issues or disabilities or things that kids are struggling with. And so the range of both of these, what they cover, really depends on the kiddo. It can cover all the way from, like I said, a hearing disability to my son, it was a written dyscrasia. I think that's how the writing specialist described it, or it could be even something like autism. And so, they're just trying to help kids succeed at their education plan.
All right, good. So, we spent the last 2 years talking about COVID. I know you mentioned earlier that, getting your vaccination was a good way to protect kids. But, what should parents be concerned still about COVID as we go into the school year?
Yeah, absolutely. So COVID, COVID has caused a lot of division amongst people, whether it be vaccine or no vaccine, whether COVID is even a real entity or, quote, just a flu-like virus. But I will say that everyone can appreciate that COVID virus has changed over time. And so there are some variants that are very contagious, and there's some that are more deadly. Some that have affected kids and put our kids in South Carolina in the hospital, even to the point of needing like ICU care. However, and it kind of fluctuates. Levels fluctuate with COVID too. And so COVID was down, and then over the last few weeks, wouldn't you know it, COVID is back up a little bit. And so I was at the medical school yesterday. I'm an educator there, as well as working in my clinic, and we asked all the students to wear masks. We're just trying to be safe. And there's an outbreak amongst students. And so we don't want that kind of thing to continue, or we don't want the students to get in the midst of an outbreak or anything like that. So when levels are high, they may wear masks. And then when they don't, they take them away. I think the school has made that very family dependent. And then they've changed their quarantines and all this. Every school, it seems like, has been coming out with different plans, but it is still a concern for kids. Kids with the most recent variant of the virus, they're doing okay. They get pretty sick for a week, like a little bit more than a cold. And then we haven't had as many kids that have gotten super sick with this virus, but we don't know. I mean, there are always new variants, and the best way to protect is, of course, the vaccine if you choose to go that way. But that is always family dependent, kind of talking through risks and balancing the benefits for their particular family.
All right. What about those children out there that have some allergies or asthmas? In the South, the allergies are really can be a lot for the year, but then we have asthma too. So what kind of advice would you give to parents on those two?
Yeah, I think the main thing I would say is, since this is a back to school type talk, there is a form that the school has parents fill out, and it's so important. It seems like for whatever reason, there are always a million forms that schools ask the students to fill out. And I always have parents that are surprised, and I don't blame them. We are always getting emails, oh, fill out this form, do this thing. Oh, that sports physical was due yesterday, whatever it might be. But in regards to asthma and allergies, there is a form that parents could obtain from the schools, and it just allows them, number one, to maybe take their medicines to the school nurse, whether it be an EpiPen if they have a severe allergic reaction, to inform the schools and the teachers of, like, let's say a peanut allergy or something like that, so somebody in the class doesn't bring peanut butter into the class. And then, having that inhaler on hand. And so parents can be ready for school by just getting those forms completed and making sure everything is in place. We always have, there's just so much that is required of parents nowadays. We just don't want parents scrambling at the last second, or kiddo not being able to go to school, or being even in an unsafe environment if they have a severe allergy. So just get ready from that standpoint.
I know that Dr. Byrd may have to drop off a little early because he has kiddos to take care of, as he was saying. So I'd like to give him a chance to really talk about how can parents set their children up for success at school? If you had to give a single thought to parents to really say, this is one thing I think you should do, what would that be, Dr. Byrd?
So it's been hinted at by everyone on the call today, Carla and Jeff and myself, but kids need, they desperately need routine or a schedule, rituals. Like kids, that's just how kids are. You remember how it was when you were a kid and you had a blanket, or your dad came home at a certain time, or you ate supper at a certain time. So the best thing and they've done a lot of studies with this, in the kids that do the best in school are the kids that are the most healthiest mentally, are the most healthiest physically, and that relates to the foods that they're eating, the sleep. And so the more parents can, in the midst of all our craziness, because we have 4 kids, the more the kids can have some type of schedule or routine, and you kind of stick to it. There are exceptions, both with what you're eating, whether it be like a plan. Some families have plans, families just kind of get home and they have like we have these meals we could do, but still having a plan for sleep and technology and what they're eating and how they're sleeping, and setting them up will give them the best foundation for success in school. I think when kids are struggling, in my experience, there's just a lot going on, and sometimes parents have no control over that. There might be a family, like a two household parents, like parents that are separated or whatever, and they're gonna it's hard to you have to balance it out, or some parents are struggling with finding food right now, and there are resources from that standpoint. So it's not always under your control, but the more you can give them that safe framework, then kids are going to thrive. But if you don't, then kids are going to struggle. And so just doing your best to give them that same framework and thinking about all those elements is the best avenue of success.
Good. Thank you, Dr. Byrd. We're going to go back to Jeff and talk about technology. I think everybody here has mentioned all the technology that we have. I think Dr. Byrd mentioned it, Carla, everybody, because we have a lot of technology, even the young kids. So what do you do as a parent, about managing that technology? I mean, what do you do about that?
Well, it's kind of an overwhelming question, I think, for parents, especially for older parents who didn't kind of come up in the technology era. So one thing is you kind of have to assume personal responsibility for, if you give your child a device, you're responsible for their use of that device, just like if you let your child drive a car. And you don't assume that a child's chronological age translates into a higher level of maturity or discretion or judgment just because they're 13 or 14 or 15. You are responsible for doing checks, and you can do that in a variety of ways. One is, like Dr. Byrd suggested, having some parameters around access to the technology, especially around social access. We understand that schools give tablets and kids have laptops to do their work and access content. So we understand there's parameters around that. But with phones and a lot of the social accounts, it's about you and your partner or other parent making an informed decision about when that child is ready to access that type of media, and then to monitor how they use that type of media, and to have ongoing conversations about what your expectations are about that media. And we all expect children to violate boundaries and test limits because that's their nature as adolescents, but we don't pave the way for them to do that by just kind of giving them a phone and say, here you go, be responsible. So the short story is parameters around use, define and discuss that, those limitations, and then checking to see that those limitations are being followed. And, as usual, if you find a violation, don't react in a way that's very animated, but more of a, what are we going to do about this? This is really not what we talked about. What do you think? And coming together to create a positive solution so that the person's not shamed, but also that the person understands the level of accountability they're responsible for as they have increasing freedom. And that's a good template for how you'll treat them as they evolve into older teenagers as well.
Yeah. We're going back to school this year. In the last 2 years, we've had sort of a haphazard school year for the kids because of COVID, on, off, virtual, not. So some families and kids might be a little anxious about going back to school. So what would you say to those parents and children who are a little anxious?
Communication. Your job is not to make your child not anxious. Your job is to teach the child to manage anxiety, to increase their skill set for managing anxiety, to seek out the appropriate resources if they need help to manage it beyond what they personally are able to do, and to normalize their reaction instead of criticize their reaction. I think that the more you communicate that, the more you emphasize that it's normal to be anxious, and then, looking at different types of anxiety. And if you need additional support, then that's when you reach out to a professional to increase specific strategies, for example, for generalized anxiety or social anxiety. Those things may manifest themselves at different developmental stages when you're overwhelmed with peer or other responsibilities that you want to perform well at.
What about the fact that some parents in that anxiety or anxiousness about what's happening with their child may start what some people put in quotes and call helicopter parents, those people who are probably monitoring a little bit too close? Or so what would you say, how parents, how can they manage not over managing their child?
Sure. Yeah, well, first of all, we want to understand that helicopter parenting, so to speak, is born of a good place. It's born of a desire to make sure our child feels comfortable and they can matriculate successfully throughout their growth and development. When it becomes interfering, it's kind of rooted in both. The child is anxious about what they can and can't do. The parent is anxious about what the child can and can't do. And we see a pattern of overcompensating and giving the child what they need before you let the child go through the natural steps of trying to figure out or solve that problem themselves. So we have to really normalize that the child has to have some disappointment and failure to have the context of how to navigate through difficult situations. So that's really a good thing, even though it may feel awkward to witness it or to experience it. So you want to catch yourself when you're overfunctioning for the child. You want to ask for support. Do you think I'm overdoing it? You want to listen to feedback, and you want to make sure that you're normalizing their developmental gains. Is this person able to do what they should be able to do independently at this age? And that may be a good indicator for, whether or not you're overfunctioning for the child.
All right, so we're gonna go back to Carla and ask her a nutrition question, because in addition to all the things that Jeff said, we still are trying to make sure these kids are fed well. All right, Carla, so here's the question. I know that my son, who's now a grown up, went through a period where he only wanted to eat macaroni and cheese. Like, the box kind, not even like the good kind, that you're, make it home with, but the box kind. So how are we, and kids get to be extremely picky eaters at some point during their development. So what do we do about as our child grows and their eating habits change? What's the easiest way to help those children who are picky eaters?
Yeah, and it's a process. Everyone goes through times in their life where they're picky eaters. I'm a dietitian now, and I had a phase where I would eat grilled cheese sandwiches and lime jello, and those two things. So that's a normal thing to have these opportunities in your life where you're going through phases. But your job, one of the hardest things as a parent is your job is to provide healthy foods. Your job is not to cater. And keeping that in mind, because we want to make our kids happy. And a lot of the time we use food as that, like, oh, I want to make you happy too. Here, let's go out and get some Wendy's tonight. And like, yes, I see that can be occasionally a great thing, just that opportunity to spend some quality time. But your job is to provide and not to cater to every whim. So knowing that day to day, what that looks like is also not forcing those vegetables when we say no, when they say no. Having the opportunity to come to them. Hunger can be a wonderful motivator when it comes to vegetables. One of the great tactics my mom did when I was a child is even when dinner was being made and I was starving, hungry, coming home from gymnastics practice when I was a child, there was always vegetables on the table. And I was allowed to touch any bit of the vegetables and eat the vegetables if dinner wasn't ready yet and I was hungry. So I learned to eat vegetables because I was hungry first. So that may be that you do serve a salad or a vegetable first, and then the real meal comes out sometimes. And they're not forced to eat that vegetable, but at least give them that opportunity maybe first if we're a picky eater. And starting younger can be really, really helpful. This is only going to get more challenging if we get later and later, and we were never given that opportunity to have those vegetables every day. So vegetables are usually what we think of with picky eaters. They just are on the plate, or if you have a child that maybe has some developmental delays or developmental issues, maybe in a side plate if foods can't touch, and that's okay as well. Just allowing for these opportunities and start small. I call them my gateway vegetables. These are like the crunchy ones, like carrot sticks, bell peppers, cherry tomatoes, cucumber slices, the really easy ones. Sometimes it's asking the question of, okay, what vegetable do you want? And allowing them to be the decision maker, but that doesn't end up being, what do you want for dinner? And so if you ask, what do you want for dinner? It's going to be mac and cheese. It's saying, okay, that's great. We have that as the fat in the starch. What do you want to do for protein? What do you want to do for the vegetables to add into that? So allowing your child to think through and learn from those behaviors can be really helpful. Parents are also major role models in this. I can almost promise if there is a parent that refuses to dry vegetables themselves, I will probably have a child that also does not want to try vegetables. So everyone is included in this. Nobody is excluded from the goal of having some healthy vegetables in their plate. And working with that, even if you're 40 years old. And then also talking about food and describing those foods. I try to avoid or try to discuss with parents getting rid of some food words. And so the words ew, gross, disgusting, ugh, nasty, we try to avoid those words. Maybe it's saying, I don't like this carrot because I don't like the texture. I don't like the sliminess, but that also makes it so the child next to that child also is not hearing that this is gross, I don't want to eat this. So if I say something doesn't taste good, the child next to me is going to say it doesn't taste good. So having those discussions of, I don't like this, but that's okay. It's still something that you could like. So having those open communications can be really, really helpful. And if your child is still struggling, there is feeding therapy. And that is something we do offer as part of Prisma. It's through speech language, and that would be something to maybe consider talking to your child's pediatrician about.
Yeah. All right, so I'm give you some final thoughts. Kids are going back to school. If you had to give one thought to parents about that, and their as a dietitian, what would your thought be?
I mean, the hydration. I cannot press enough of how important hydration is for so many reasons. keeping it, I think a big tactic of learn to drink some water. It helps out with your mental health, your physical health, your cognitive abilities. Hydration is such a key piece that usually gets missed when it comes to nutrition.
Good deal. I'm going to go back to Jeff for his final thoughts. All right, Jeff, back to school, mental health, behavioral care. What would you give the tip you would give to parents?
I would say don't ignore significant signs or prolonged signs of a change in behavior. Isolation, avoidance of usual social or academic tasks, reluctance to engage in conversation where they used to be able to discuss that with you freely. Some of it, of course, can be developmental, but don't assume it is, because if you overlook a significant mental health problem, it's harder to recover from that. So just keep a close eye and stay healthy and take care of yourself. I always advise parents, you can't help them if you're not doing pretty good yourself.
Good, thank you. Wow, what a great panel. Thank y'all so much. So thank you for joining us today for our Back to School Town Hall. And if you have additional questions, please put them in the comments and we'll try to get one of our experts to answer them for you. We know that you'll all be ready to get those kids back to school, and we're here at Prisma Health willing to help too. So we also have a blog called Flourish. So it's prismahealth.org/flourish, FLOURISH, and we'll put that in the comments. We have lots of great blogs and podcasts there that also can be a great resource for you. So thank you so much. Good luck to all the parents and kids as they go back to school, and we wish you the best. Thank you.